She's not that. There's another Welcome to today's show, the Pet Pawcast. I'm your host, Dr. Roberta Westbrook, and we're here at the Campus for All Animals, the Houston SPCA. And today I'm going to give you lots of good information, so get your questions ready if you have questions about diseases that are common in cats. So we're going to cover just kind of a variety of diseases that we see fairly often in cats and kind of give you just a little bit of information about how you can recognize these diseases, when you might see your veterinarian, and some of the recommendations that your veterinarian might have for your pet cat if you notice that your pet is getting some of these symptoms and clinical signs. So start thinking about some illnesses that you have in your cats or that you're curious about, and I'll see if I can help you answer some of those questions. And in the meantime, I want to introduce you to one of our wonderful cats that we have available for adoption here on our campus. This is Queenie. Queenie is about a 1-year-old female. She's already spayed and updated on her vaccinations. Queenie came to us from a hoarding situation. Unfortunately, we do have cases where animals are in a situation where there's just too many of them and they're unable to be cared for well. And they wind up coming to us, sometimes unsocialized, scared, with diseases or injuries. And Queenie came from one of those situations, but she's been very lucky because she's healthy. And she didn't have any problems when she came to us, other than just being scared and nervous. But as you can see, she has come right out of her shell. She's friendly. She loves people. She loves to play. She's going to make a wonderful, wonderful family pet. So come on down to our campus. There's no appointment necessary. You can come on in, bring your family, bring your friends, come make a day of it and see all of the dogs and cats and puppies and kittens that we have available and see if Queenie would make a wonderful pet for you. So, I want to talk about some of the common diseases that we see in cats very frequently. When I was in school, they used to teach us about the big three cat diseases. And the big three cat diseases were those diseases that, if your cat lives long enough, you might see one of these diseases. And so those diseases are diabetes mellitus, kidney disease, and hyperthyroidism. These are fairly common diseases that we see as cats get older. And so I thought we could focus on those, but certainly there's lots of diseases that you guys might see in pet cats that we can touch on today and in some future shows. So I'll start with one of the ones that may be common, and that is diabetes. Lots of times people don't recognize, oh, look at Queenie, she wants to come on to the show. So lots of times people may not realize that cats can get diabetes. Most of the time we've heard of diabetes being a human disease, and it may be that you have not known that cats and dogs can get diabetes mellitus. And so if you have a cat, one of the things I want to say about the risk factors for diabetes, which is similar to the risk factors in humans, is body weight. So if you have a cat that is overweight, significantly overweight, what can wind up happening is the body, your cat's body, may not be able to secrete enough insulin to help your cat process all of the sugar that's coming into the body. And so it's very much like diabetes in people, type 2 diabetes in people, where it's a relative deficiency of insulin because of being overweight. And so the good news in cats is that one of the things that we can focus on for our overweight cats that might be diagnosed with diabetes is focusing a lot on diet and weight loss. And oftentimes that can really help them to become in remission from their diabetes. So do you have any questions about diabetes in cats?
So then do they have to have the same type of insulin as we do in humans?
That's a great question. So if you have a cat with diabetes, do they need insulin? You might recognize that in people, they take insulin injections on a daily basis. And does that need to happen in cats? And the answer is yes, that oftentimes is the way that we are going to treat, manage, and in some cases, cure diabetes in cats, and that's with insulin injections on a daily basis. Now, when if your cat is ever diagnosed with diabetes, your veterinarian will determine which type of insulin is best for your cat and how often those injections might need to be given. They will teach you as a pet parent how to give those injections, and they'll properly educate you, so don't worry. But yes, insulin is a huge part of treating a cat with diabetes, in addition to diet. So weight loss and diet is very important. Your veterinarian may often recommend that you change your cat's diet to something that is going to be usually higher in protein and lower in carbohydrates. Cats need protein. Come here, Queenie. Come here. Let me see if Queenie wants to hang out. Hi, this is Queenie. Look how beautiful. Now, Queenie has a wonderful, wonderful body condition. She's not overweight at all. So she's right now not a risk factor for diabetes. But look at this beautiful kitty. Hi.
And so what are the main symptoms for diabetes?
Okay, so symptoms of diabetes. Diabetes would be first overweight, but your cat may notice, even though you have a fat cat, your cat might begin to lose weight. So polyuria, have you heard that term, polyuria? That means urinating a lot. Polydipsia, that means drinking a lot. And polyphagia, that means eating a lot. Those are three of the common things that you might find in diabetes, in addition to weight loss. So that might be confusing because you might say, my cat's eating more, why would they still be losing weight? That's one of the things that happens with diabetes, is you might have an overweight cat. The cat now is not able to metabolize energy the way we want them to, and so they begin to burn fat for energy, sometimes muscle for energy, and so they tend to lose weight. So what we want to do is make sure that you are keeping your cats at a healthy body weight and looking out for too much drinking, too much urinating, too much eating, and weight loss.
So Liana asks, what is the recommended amount of food that you want to give to them daily?
That's a great question. It's just really going to depend on the cat. So that's a very individual thing, just like it is for people. The amount of calories that your cat takes in is going to be really individual. So I would say contact your veterinarian. What they're going to do is weigh your cat, determine what body condition score your cat has, whether your cat is, too obese or too thin, and using that and the type of food, because it also depends on the type of food that you're feeding, how much you should feed every day. So each type of food has a different caloric density, and that is going to be important in determining how much of that particular food your cat should eat. So It's not a simple question. It's going to depend on even how active your cat is. Older cats that are kind of sedentary may need less calories a day, and that's a different type of food versus a young active cat like Queenie, who's going to be really active and burning a lot of calories and might need more food per day depending on the type of food that you're feeding.
And then once they're diagnosed, if they were diagnosed when they were young, is that a prolonged disease?
Sure. So if your cat is diagnosed relatively young, which we don't often see, typically it tends to be as they get older and gain weight. But if your cat is diagnosed at a young age, it can be a chronic disease. I mean, it is something that needs to be managed for life. It is not impossible, though, for cats to go into remission from diabetes. So with proper diet and management through insulin, we are sometimes able to reverse that diabetes in cats if it gets treated well and is managed well. So it's possible that it may not be a lifelong condition in some cases.
Somebody else asked, my cat isn't using the litter box anymore. Could this be behavioral or a health concern?
Oh gosh, what a great question regarding cat diseases. That is inappropriate elimination, or basically when your pet is not using the litter box like he or she used to. So that's a very common issue that we see in cats. So there's a couple of ways that you can approach inappropriate elimination in your cat. So if your cat is not using the litter box anymore, there's a couple things that you can check. Make sure that you are keeping the litter box clean. Cats can be very much sticklers about going into a clean litter box. So make sure you're scooping that litter box out regularly, keeping it clean. That's going to help them want to use it more frequently. Also, try to search in your history and see if you have switched the litter frequently as well. Sometimes a switch in the litter can make a cat not want to use the litter box. So you want to pay attention to that. You also want to pay attention to where the litter box is placed and how many cats are using a particular litter box. So sometimes this has happened even in my personal life, where the litter box is placed in an area where the cat is a little bit nervous about going. For example, if you've put the litter box next to the washing machine or the dryer, and your cat tries to go to the restroom and then the dryer turns on and it's making a lot of noise, sometimes that can scare them. That makes them not want to use the litter box, so they're going to use the restroom somewhere else in the home. So make sure the area is easy to get to, that it's in a private, quiet space they're not going to be nervous about. Maybe don't put it next to the dog bed where they've potentially got to cross the dog to get there if they have a contentious relationship. So there's lots of things that go into that. Start, though, with talking to your veterinarian about ruling out medical conditions, because if your cat is using the restroom somewhere else in the home, let's make sure that there's not a medical condition that needs to be treated, like a urinary tract infection or something of that nature. If it's not a urinary tract infection or something medical, then yes, it could be behavioral. And behavioral could be that the litter box is just in not a good place. It could mean that you need more litter boxes. It could mean that your cat is stressed and has a different behavioral condition. So contact your veterinarian as a first line to see where we need to go with that.
So other than not using the litter box anymore, what are some key symptoms for urinary tract disease when we know it's not behavioral?
Yes. So if it's not behavioral and it's truly urinary tract disease, you might notice that, yes, they're using the restroom somewhere around the house. You could notice that the urine changes in color. Sometimes it's darker in color. Sometimes it has blood in it. Sometimes it's painful. And so you might notice that as your cat is squatting to urinate, that he or she is making a lot of vocalizations. Those things could indicate that there's more of a medical problem and not a behavior problem. So again, those would be times where you definitely want to take your cat into the veterinarian and get that checked out. Sometimes it's not an infection. Sometimes cats can have urination problems because of stress. It's stress related. And so we want to make sure that we are recognizing that, and we're doing all that we can to reduce their stress, to make their environment calm, and kind of reduce the chances that they're going to have inflammation in their bladder.
You did mention hyperthyroidism. What can a cat owner look for to make sure we're not reaching that stage of life?
Yes. So hyperthyroidism can also be shown to have similar symptoms really to diabetes. Sometimes cats get very, very thin with hyperthyroidism because what's happening is their metabolism is accelerated. So they're burning lots and lots of calories, and because they're burning lots and lots of calories, they're wanting to eat more. So you can have weight loss, you can have polyphagia. Sometimes they get a little bit temperamental when they have hyperthyroidism. They may become a little bit more irritable. You might notice that their hair coat becomes somewhat unkempt. So their hair coat becomes sort of like they're not grooming themselves. It becomes dry, or it's not laying nice and flat. Sometimes their nails become thicker and longer. And so those are some of the signs that you might see in a cat with hyperthyroidism. If you notice some signs like that, typically this is an older cat disease as well. So if you're noticing signs like that, again, talk to your veterinarian because sometimes the thyroid that sits right in the front of the neck here can develop a tumor. And that tumor can be functional, meaning that it creates more thyroid hormone, causing accelerated metabolism, causing your cat to lose weight, and lots of other sort of side effects. So if you're noticing these signs in your cat, please talk to your veterinarian. They can do blood work. It's relatively easy to diagnose this with physical exam and blood work. And then there's multiple treatments that are successful. So this is a treatable condition as well.
Somebody asked, my cat was recently diagnosed with FeLV. Would this shorten their lifespan?
Oh, that's a great question. So FeLV, well, first, what is FeLV? So FeLV stands for feline immunodeficiency virus. And so this is a virus that is incurable, that does affect your cat's immune system. So what it means is it can suppress your cat's immune system over their lifetime. Now, cats can live for a very, very long time and live a complete full life with feline immunodeficiency virus. What we have to do as veterinarians and pet parents who are caretakers of these cats is make sure that we are keeping them healthy so that they are not prone to diseases that they could succumb to. So that means taking them into the veterinarian more often. Oftentimes, cats with FeLV, we recommend going to the veterinarian twice a year instead of once a year. We want them to stay current on their vaccines. We want to make sure that they are not exposed to diseases from other cats. So it is about just being a little bit more careful about keeping their environment protected, but they can live long, healthy, full lives with this particular virus.
Is it safe to bring another cat into the home?
So FeLV, feline immunodeficiency virus, can be transmissible to other cats. Now, it's not transmissible generally with casual contact. It usually takes, the transmission is usually through bites. And so if you have cats that are fighting and biting each other, it's more likely to be transmitted between those two cats. Usually casual living is less likely to transmit the virus, but it is something to consider. So cats, one cat that's FeLV positive can live in a household with an FeLV negative cat and household, but it's important that you're aware that that disease can be transferred, particularly if the cats are fighting, and to just take precautions. What I would do in those cases is have the cat that tests negative, see your veterinarian again regularly, and at least be tested on an annual basis to see if the disease has been transmitted. But can they live in harmony for life? They absolutely can, and you don't have to keep them isolated.
Is one that's similar that people have heard about is feline leukemia. Is that similar to the other one or similar to our leukemia that we find in humans?
Yes, feline leukemia virus is another virus that is incurable that also affects the immune system. Now, in general, feline leukemia oftentimes has maybe more of a severe response to it. So cats may not live quite as long as a cat with FeLV. Sometimes cats with leukemia have more clinical signs sooner than cats with FeLV, but this isn't always the case. Sometimes they live for many years with no problem. So this is a disease that, again, you want to make sure that you're keeping your cat healthy and preventing disease so that their immune systems can stay strong and fight off any diseases. But with both diseases, FeLV and leukemia, sometimes very simple diseases like upper respiratory infections or diarrhea, sometimes they can be more severe and more difficult to treat in these cases because these cats have suppressed immune systems. And so your veterinarian can talk to you about how to prevent these because that's going to be better than the treatment.
You mentioned upper respiratory infection. Or how does a cat get that?
Very common. Upper respiratory infection in cats is just like the common cold in people. It's very common. It spreads through respiratory secretions, respiratory droplets. So let's say you're, spending time with someone at work or at school. Someone has a cold, they cough, they sneeze. Those aerosolized particles float through the air, unbeknownst to us. We oftentimes don't see that, and we inhale them, or they get on our hands, and we those particles get into our nose or in our mouth, and that's how we contract that. It's the same way for cats. So it is spread through aerosolized respiratory particles, through coughing, sneezing, and it's treatable. So even though, they're congested, they have runny eyes, oftentimes a congested nose, they're sneezing a lot, it's treatable, and usually they are well in about 2 weeks. Sometimes cats can have it again and again and again, and they can be kind of chronic snufflers, kind of cats that chronically have nasal discharge and sneezing, but it's still very manageable. The cats can still live a very good quality of life for a very long time.
Somebody asked, is it true that cats always land on all fours and walk away from injuries?
Oh, yeah. So another common cat disease in some areas of the country. So we always hear this: when your cat falls off of a high platform, that they're always going to land on their feet. They're always going to land on all fours. And that's mostly true. That may not be true if they're falling from a lower platform. So if they fall off of the couch, for example, or a low bed, sometimes they don't have time to right themselves before they hit the ground. Oftentimes, if they're falling from a higher platform, they have a little bit of time to right themselves and land on all 4 feet. But if that's a lower platform, they certainly can still injure themselves. And they can injure themselves from falling from any height. So we don't want you to think that cats will not be injured just because they land on all fours. Sometimes the force at which they land can still put enough pressure on the bones to cause fractures. Sometimes the head will still hit the ground and can cause fractures of the jaw. It's a very, very common injury when cats fall from high places, that their face hits the ground and they can sustain fractures of the jaw or the face from what we call high-rise syndrome, where cats have fallen out of high rises. That's less common. It's more common in the north, where people are living in high rises a lot. Maybe less common in the south, but it can still happen if you're living in an apartment building and your cat is on your balcony and falls off. So please try to keep them safe, keep them off those high rises, and hopefully we can avoid some of those injuries.
So still be aware even if we're on the first or second floor.
Sure, they can still injure themselves even on the first or second floor. They may land on all fours in some cases, but they could still sustain some injuries to their limbs and maybe even to the face.
All right. I don't think we have any more questions.
Well, that is great. I did want to mention, another thing you want to be aware of as your cats get older is just making sure you keep them healthy, taking them to the veterinarian regularly so that we can catch these diseases sooner. The sooner we are able to catch them, the more likely we are to be able to manage them and to keep them with a good quality of life. So check in with your veterinarian regularly, but also come on down, take a look at the cats that we have here available for adoption. And you can also plan this weekend to visit one of our PetSmart stores, where the Houston SPCA puts adoptable cats in PetSmart stores. You can go to PetSmart on Kirby or Alameda or Eldridge Parkway. These are stores where the Houston SPCA takes some adoptable, wonderful cats to find their forever homes. So if you get some time this weekend and you can't make it out to the shelter, try to visit one of those PetSmart stores for adoption week and see if you can find a cat that will fit your family there. Hi, Queenie. Queenie wants to say bye to everybody. Come on down and see her. Look how cute. We will see you next week on the Pet Pawcast. Thank you for joining us. I'm Dr. Westbrook. We'll see you next time. Right, Miss Queenie?